If your back pain doesn't stay in your back but shoots from your buttock down one leg, into the back of your thigh, your calf, or even your foot, as a sharp, burning, or tingling pain, that can be a classic early sign of a herniated disc in your lower back. That radiating leg pain even has a name: sciatica. Here's the reassuring part. Most herniated discs settle down without surgery, and there are simple things you can check and do at home. In the next few minutes I'll walk you through what a herniated disc actually is, the telltale symptom pattern, an at-home self-check, how it differs from spinal stenosis, what really helps, and the warning signs that mean get. So let's start with what's actually happening inside your spine. Between the bones of your back sit soft cushions called discs, and each one has a jelly-like center wrapped in a tough outer ring. A herniated disc happens when that soft center pushes through a crack or tear in the outer ring and presses on a nearby spinal nerve root. That's exactly why the pain doesn't stay in your back. It travels down the path of the irritated nerve into your leg. And it isn't just pressure. The leak material also triggers inflammation around the nerve, which adds to the pain. Most of these happen at the two lowest segments of your lower back, which together Now, how do you recognize it? The most distinctive sign is that the pain radiates down one leg, and it often gets worse when you sit or bend forward. Run through a quick mental checklist. Does pain spread from your low back through your buttock and down one leg as tingling or shooting pain? Is it worse when you sit? Do you get a jolt down the leg when you cough, sneeze, or strain? And do you feel numbness in part of your foot, or weakness lifting your foot or big toe? Here's a simple check clinicians use. The straight leg raise. Lie flat. Keep the knee straight, and slowly lift the painful leg. If an electric pain shoots down that leg somewhere between about 30 and People often mix up a herniated disc with spinal stenosis, and the clearest difference is that the two react in nearly opposite ways to posture. A herniated disc tends to feel worse when you sit or bend forward, and it usually sends pain down just one leg. Spinal stenosis is the reverse. It often feels better when you sit or lean forward, but worse when you stand or walk, and it tends to bother both legs at once. There's also a difference in who gets each one. Disc problems show up in a younger group, roughly ages 30 to 50, and often come on suddenly after a specific movement, while stenosis builds up gradually in older adults. A simple way to remember it: worse when sitting points to Here's some genuine reassurance. About 9 out of 10 people with a herniated disc improve without surgery, and most feel better within a few weeks, with around 90% improving by about 6 weeks of conservative care. So a numb leg rarely means something is about to go seriously wrong. In the early, painful phase, it's fine to rest, but keep it to a day or two, not prolonged, because too much bed rest actually slows recovery. Lying down with a pillow under your knees often eases the pain. Once the worst settles, start with gentle, low-impact movement like walking, and avoid anything that shoots pain down your leg. Over-the-counter pain relievers, physical therapy once the acute pain. Before we finish, the warning signs that you should never tough out. Go to the emergency room right away if you lose control of your bladder or bowel, if you can't urinate, or if you have numbness in the area that would touch a saddle, your groin, genitals, and inner thighs. The same goes for both legs going numb or weak at once. Rapidly worsening leg weakness, a foot you can't lift, or back pain with fever or unexplained weight loss. These can signal an emergency that needs treatment within hours. So to sum up, pain radiating down one leg that's worse sitting can mean a herniated disc. Brief rest then gentle movement helps most people heal within weeks. But those red flags simply